Thank you.
Yes, he is.
Let's go first.
I'll go ahead and go first then, if that's all right. Go ahead and call the meeting to order. It looks like it's like 3 minutes after 6. Would you do a roll call for us, please?
Nate Holder,
Here.
Avery Wynn.
Here.
Angie Odom,
Here.
Jerry Prophet, Lisa Childers,
Here.
Paul Smith.
Here.
Daniel McIntyre,
Here.
Thomas Prophet.
Here.
Does everybody have a copy of the agenda in your packet? Can I get a motion for approval of agenda, please?
I'll make a motion.
Second.
Can I get a motion for approval of minutes from April 2023?
I'll make a motion to approve the minutes. I'll second it.
Do we need a yea or nay on approval of the agenda first?
All in favor? Any opposed?
This is for the current agenda, correct?
This is for the current agenda. Any public comments at this time?
For minutes.
Right.
Oh, for the minutes, yes, let's go ahead and do another roll call.
You want another roll call for,
You have to, for April, have to be called individually.
for minutes? Nick Holder,
Yes.
Avery Wynn,
Yes.
Angie Odom,
Yes.
Jerry Prophet,
Yes.
Lisa Childers,
Yes.
Paul Smith,
Yes.
Daniel McIntyre,
Staying.
Okay,
and Thomas Prophet.
Yes.
no public comments at this time. As far as new business, I put on the agenda resolution honoring John Henson. I know that our county commission meeting is on schedule for the 15th of May, and that just happens to be part of National Police Week. And a lot of people may or may not know that John Henson has served this county for almost 6 decades and has always been very proactive in law enforcement. And he has a lot of stories to tell. He's really been an advocate for this county in those almost 6 decades. So could I get a motion to approve the resolution to be on the agenda for May?
Motion to approve.
I'll second.
All in favor? Any opposed? At this time, I don't have any old business. Do any of the commissioners have any comments they'd like to make?
Will he be able to make it the 15th?
Yes, I have been in communication with John several times this past week. And a matter of fact, I met with him last night at Nancy's, and he's up for it. He is physically, he's doing really
His family can come too. Hopefully his family.
Oh, yes, I've already mentioned it to the Constable Association, and John has mentioned it. I have been very, very open in my communications and telling them what my intentions were and when it would potentially be put on the agenda and everything for the main county commission meeting. Any commissioner comments?
No. I'm fine with that. I've known John probably as long or longer than anybody here. We could add some stuff to the memoirs, but there's some felonies involved in that, so I get the
And one of the things too is the constable, Harvey Schaefer's got together, and I've worked really close with him about trying to nail down exact dates and times and the different sheriffs he served under, what his job duties were, a lot of things, and what he did also for the citizens in the community while he was sheriff, that he went above and beyond. And that's going to be part of that too. Any other comments? Can I get a motion to adjourn?
Make motion.
One second.
Thank you.
2 seconds.
I'll go ahead and call the. Are you ready, Gwen? You ready?
Roll call.
No, are you ready for me to start? I'll go ahead and call the health and welfare meeting to order. We'll use a roll call from the law enforcement meeting. Need a motion to approve the agenda. Make a motion to approve.
One second.
All in favor? Now I need a motion to approve the minutes from the April meeting, please.
I'll make a motion.
Second.
Who made the motion?
Jerry made a motion. Second it. All in favor? Any opposed? Public comments? Nothing. I don't have anything in old business. The only thing I've got in new business is the discussion of the EMS contract, and both the directors are here. If y'all have any questions. So if you'd like to say anything?
Questions, I mean, you've got the contract.
Yeah, it's right here.
Want to approve or disapprove that contract, or what's the deal?
I mean, if it comes through here, then it goes on the budget.
Yeah, well, does it have to, I mean, with the amount of the money aspect, that would have to be approved by budget, wouldn't it?
Yeah.
Vote yay on.
If we vote tonight, then we'll send it to budget and we'll figure out.
I'll make a motion, we approve that contract.
Got a motion by Mr. Prophet, Mr. Jerry, a second by, you want
Make
it?
the motion.
Made a motion to,
Jerry.
That's me.
Angie did.
yeah, we'll do a roll call.
We'll take this to budget the other time.
I'm sorry.
Yes,
Okay.
they said it had to come to us to get approved.
Yeah, got it.
Yeah, she-
I've been attending on the budget, it's just because I'm learning. But yeah, it was in budget. And then they said it had to come here to be approved, but I'm sure it still has to make its way back.
Does anybody have any discussions before we do the roll call on this? I'll answer questions.
So that would be a 4-year contract.
Four-year contract, same amount, 4 years. And after those, anything in between, 4 years straight out. You know, we've got to where we've got to have some future out there to be able to build. I'm hoping it'll go through that way. We can build because we got stations to build. It's in right now. So hopefully, when we get up toward home, but some of them, in reality, we need 2 trucks around the mountain all the time. We need 2 trucks in the west end all the time. Or, you know, to make it work, or Hampton too, but, you know, we've got a full staff right now, but we're still looking at hiring people for the future. And, I just gotta have stability there for 4 years. Next time. The medical, everything's went up so high that we can't, you know, we can't do it no more. Everything is just.
How are you doing? How are you making it with the prices of fuel? I guess you have some diesel.
Well, we got the gas, but, you know, we had a contract with the city, and we got our fuel there. And they came back and it was at 20
cents a gallon.
20 cents, cut it 20 cents a gallon on us. So, it's
Gave us a
still,
break, yeah.
yeah, give us some break, but,
I actually have several people ready to hire, which is, they're not in our budget right now, but I actually have extra people that I could man moving trucks with if we can afford them, which is amazing. I'm really happy about that we have more than we can take
Yes,
right now.
you don't think about it, you look at somebody else, the mayor, you want us there right then. You know, and the staff level that we've got now, and not strategically putting these trucks in the right places, it's gonna take a while. You know, I was telling you this last time, I think, the rescue off the mountains, at one time, it's 8 or 9 people. And then we had a cardiac arrest and a seizure there in Rome Mountain. I had everything in town everywhere in Rome Mountain. So we gotta have more people to run. People are just requesting, demanding.
Let me ask you,
Yeah.
contract, is this a 4-year contract?
Yes.
Okay, you know, the rise, the cost for everything going up and the manpower or women, whatever power, employee power you're gonna need, are you going to be able to make it on a yearly basis with this contract as you?
That's what I have projected.
Would you need to maybe work on that contract, or what I'm trying to say, where you can?
In other words, after,
Amend it.
amend to each
amend it
year.
annually? Because you're not gonna cut it like that.
Well, I was trying my best, I was trying my best to be conservative as best I could. And I figured out that stuff in 4 years, that means there's no increase whatsoever. But I still think I can do it with what we've got instead of an increase. And that was questions some of my board members said. You're not asking for an increase each year, cost of living or anything. I'll be lucky if I get the 4-year contract. You know, the way I've been done, you know, in times in the past. But those days are gone. It's either you do it or you don't do it now. And people are, I mean, got people that's, you know, got degrees and stuff in the back of their lives. They're not out here digging a ditch for a living. They're professionals. And I have to pay them well.
We're backing you.
And when you've got somebody that's, I mean, we're going to Knoxville next Saturday for 2 of our medics, one of our EMTs, they're awarded the Star of Life because what we done and had to quit. She's walking today, no problem. She was dead when we took her. That's what, you know, you pay for. And the coverage has to be covered. There's no more, hopefully, we've got an ambulance. We gotta know that we've got the ambulances for our population. And just like Hampton, Rome Mountain, the West End, I had to come out of the hospital in the West End because of the COVID, they had to take their room back over. So we lost our station. We're trying to find something in the West End right now, got in the realtor's hands to find just a piece of property. We'll pay it off and then sometime later build. Those people deserve it. Rome Mountain deserves it. Hoagie deserves it. So, you know, there's just no more playing the game of hope we have it.
I'd like to project, you know, now, we don't know how this will work out at our local hospital. So I'm just saying, more than ever, this is important.
I'm transporting people right now because of the intensive care unit.
Are you? In other words, are they,
Bristol, wherever. And Ballard.
what do you mean by that? I mean, because they're not accepting them there, or
They ain't got nobody in ICU.
so there already isn't any patients in ICU?
They told us if they have a problem, diabetic acidosis, they can't take them there. If they have a drip of various things, we can't take them there, and they're trying.
And that was a change. They were taking them and now they're
Now
not.
they're not, and they're going
And,
to
you
Bristol.
know, and I've always said it, and I've already told Ballard, went up to their upper management and said, the people have the right to go where they want to, and I'm
Yeah.
taking them there.
Yes.
If it's within the locality of our region, that's Bristol, Kingsport, Houston Valley, Irwin,
Cannon.
Cannon, we go to Cannon. But they're controlling which war we take.
I was about to say, so you're going to Bristol because they've told you to go to Bristol.
Yes. They will, I mean, just like the VA, I've walked into, our cruises walked in, and I have in the past when I was on the truck, the doctors, nurses outside wouldn't let us in. They would not see the patient, but we had to go to Johnson City Med Center at that time. So they hold a big thing and basically where these people are going now because they've set it up this way. Cardiac here, strokes here, you know, whatever it may be, they take care of what they can, then it comes into the mothership.
Right.
And so, I mean, they've developed it so huge.
Well, I just want to recap something. I'm sorry. I just want to say about Ballard. You know, you all as commissioners, we were in that meeting and he stood here and said there would be no changes. Did he not that night in here? Then 2 days later, we seen it on the news about ICU. And then all these calls started coming, you know, and people were talking about that. So even just right before the meeting, I made sure to I called Nashville at the contact there in the lasting department area where there's going to be changes. As of this moment, there's still nothing filed by Ballard to change anything at Nashville. But you're telling me they're already changing things, even though they've not filed
I
anything.
meet Thursday morning with the CEOs and stuff, discuss it.
And if they do at the last minute, they still have 2 or 3 more weeks to put their paperwork in for the change. If so, there will be a hearing, and just like they can present their case of why to remove it, we can present as a county our case of why we want to keep it. And they said that would be on June the 6th and the 7th in Nashville. So I just want to point that out because I will personally be there if that's the case, because it's not just Carter County, you got Johnson County. You've got, if that is removed, that makes a difference of all the other services that are provided. Correct?
That's like Johnson County, you know, it's just basically a 2-bed ER, 3 maybe.
But I mean, they come to our hospital.
And then
for
if it's bad, then they have to come here, you know.
But I mean, most of them use our hospital, you know, from there. But no, that would mean within the hospital, they're changing their services up. If you don't have an ICU, there's certain other services you won't be doing. So I just want to let you all know, as of right now, they've not filed anything different, but you're hearing from him. There is already a change. So that already tells us what direction we're going in. But they haven't filed yet. But again, that's going to be, they think it will be on June 6th, even though there's 2 days.
Deadline that they have to file.
You know, the gentleman today said they still have about 2.5 weeks, almost 3 weeks.
Wait to the last.
They're gonna wait till the last minute, so nobody knows to be there for that hearing.
It's like
So I'm
Medicare.
telling you now when the hearing is.
It's like Medicare. We just got back from the meeting with Medicare and everything. And they're starting now. They want to get rid of these small communities into big hospital bases. That's what they want because they have to pay out so much, so many checks and control of the public. That's what's happening.
Mhm.
They said it right 2 weeks ago, last weekend down there. So it's coming, you know, it's coming and Ballard's a little bit, you know, further than what I would like, but they're there. But it's a lot of the rules I have to follow through the state and all that federal rules. But it's not because I want to,
Right.
believe me.
Well, that's all the more reason why we need a rescue squad. Because if they do start removing these services, we're even gonna need more transport, and that's just how I look at it, and we're gonna need more people. So that's just my thought. Sorry.
Did you have a
Oh,
question?
no, you're fine. All right. Okay, I just want to make sure. I just want to make sure, clarification for me. So it's already to a point where you're being told based on the medical diagnosis, severity of the emergency, where to transport someone for care. And so you're having to travel a further distance because Bristol is a further distance, even as the person, the CEO of Ballard said, oh, it's only 10, 11 miles down the road. But to me, the citizens of Carter County are being put at risk because that 10 miles could make a big difference in an emergency case. And that's what really concerns me. And Sycamore Shoals has been a hospital for many, many years. Carter County continues to grow with the influx of people that are relocating here. Our population is growing. Don't know if you've looked at the housing market in the last couple of years. The affordability is out the window. Plus, people just from other states, larger states, want to come here because, we're a great county. We've got great people here. It's a great place to live. So it concerns me that the citizens of Carter County are being put at risk based on what a bottom number is.
They're at risk now because I'm not staffed enough and pay, it's all one big picture. It's just like, people come in, they expect police, fire, and EMS on the spot. They paid for it all their life away from here, and they expect, that's what I'm by a person around the lake. We want you here 2 or 3 minutes. That's what I pay taxes. Well, you don't pay what you do when you was in Florida. You pay what you do now, and it's a big savings to you all. But,
It's a big savings.
You've got to have those three in schools. You've got to have the schools because these people, they look at that. They look at the schools and police and everything, what the response time are before they decide where they want to live.
When you look at the response time, and if you're having to go to further distance, first of all, that's putting the ambulance, the driver, the staff, that's taking them out of the equation. So at some point in an ideal world, what would be a good staff number for you if you could be fully staffed?
Well, at one time, we had 68 employees at one time. During the pandemic and all this other stuff, everybody run. Listen, I'm telling you, and it's God's gospel truth, when they started cutting us years ago and done what they done to us, people said, there's no future here. I'm moving to Johnson City. I'm going to go to Bristol, wherever to work, because county don't back you. You ain't nothing. I know I'm a private corporation, nonprofit, but we've always been here for the county since 1949 when it started. I don't want it to see it go. I try to convince y'all you don't want to let this go. I've worked for private ambulance services that they don't just come in, they rent everything because of the contract goes wrong. They're gone. They're going to leave you at a minute's notice. Call Irwin and ask them. Irwin right now, 2021 or I think it was 21. When they developed their own, it cost them $1.4 million in the budget. You're paying $370 or whatever it may be. That's all they do is transportation, 911. We're out here all the times of night doing training. People don't realize what we pay out in training, keeping these guys' skills as sharp as they can be. Everything. We're into schools. We try to do what we can.
Did the prom?
But the prom stuff, we just put
Twice.
a vacuum thing in all the schools for choking victims. That's a little over close to 2,000 time we get done.
It was over 1,000 easy. I can't
But the schools love it because now the child is protected if they get choked. There's no more doing what they used to do. It's just 2023.
But that's school food.
Still works, but
Let me ask you something, Terry, not shut up. Contract, you mentioned you need money, you gotta have money. COVID is basically over, so the dust is settling, but it's coming again. Are you gonna be prepared?
there are always going to be viruses. They're just mutate.
Well, are you gonna be prepared?
Well, in that contract, if it says these disasters or whatever, then we can come back.
You're gonna be financially to an extent stabilized so you can do your services and not have to.
I have to say, I think I don't know the future. I just go by numbers, what it's supposed to be. I think we can do it. If it comes back that we have to have something, I don't care. We can change the contract, but I just try to be as easy as I can and still provide that service. But I need to have, units come almost December of the year before last. Sometime that they voted to buy us an ambulance with the PP money, that money that came. I've been that long and still haven't got an ambulance. In China, the ships for the Fords burn up. That was a big delay. Then Ford couldn't get chassis. That was a big delay. And now they can't get people to work in the factories to put them out. If I ordered one a day, I'd be lucky if I got it in 2 years, 2.5 years. And we've got Amazon's up there in 2002. And that's way too many miles on the truck. But we put them on the BLS during the day transports, not a 911 ambulance. But something's got to give for a lot. Everybody's struggling across the nation. And
I brought copies of that budget request, if any,
Yeah,
the presentation, if
well-
anybody didn't get one and wants one, I have extra copies.
I'm telling you, I've done.
Well, something you said, I
29
think,
years.
good for people to understand too, because I had somebody ask me, or Colin asked me about, do they staff room mail-in? And you had a really good point that we need, and this is a live stream, so hopefully if somebody re-listens to it, they'll understand.
Yeah.
That is, you do staff it, but if you get a call out, that takes it. So then by the time you drive from Rome Mountain, you go to one of the hospitals now, if you're going to Bristol. During that time frame, they're not staffed, and you would have to then go to Hampton or a different. So people have to understand, you have to go on those calls.
We do like a system status management thing. When one goes out, the other, that Hampton is the center of this county. We always try to keep one to go that way, either that or Poe. But you're still within 20 minutes away.
And I'm in a really good place where we actually have people wanting to work.
Thank you, Lucas.
If I can afford to hire them to make more trucks, we actually have people.
Something I want to point out, 12,000 calls a year is what they ran. And that's about 32 per day. I mean, that's, yeah, and I think 35 or 36 rescue missions last year. Washington County done 5. A lot of people don't understand the Appalachian Trail is that's where we were up there. We went one day about 12 o'clock and got somebody, went back the next day and got somebody. So, like I've told you before, if something happens to this service, you better get your checkbook out, because that rescue is gonna fall back on Sheriff Furley, that's gonna cost this county about $5 million. He just ordered a $80,000 Rover, didn't you?
ROV.
ROV. So,
We've got one and we're selling it. I've got 2 bidders right now in Alaska and Connecticut, the University of Connecticut. They're looking at it. I think around 65, looks like I'm going around about 45,000 on it to get, for them to buy it. So it ain't bad as long as I've had it. But, technology changes from a computer today, it's old tomorrow. It's just the way it is. But we provide this county with a lot of services that people don't even know we do. They still think we're a rescue squad back in the 70s. And that's their fault for not doing research and finding out what is going on. But we've been up and down this county for 29 years. I've stood here. Every time. And then when that crew got it, they just killed us. And we're still back where we was. We should be over $1 million by now. I care if it $1.4 million, 21. So.
You got the lake, Appalachian Trail, and now all these new bike trails.
well, and that's something else you gotta carry. I want to say a lot about the man that was standing up here at the last commission meeting, but I'm not going to.
I'll back it.
But he said it's only 10 miles. It's 10 miles from Sycamore Shoals Hospital to Johnson Med Center. 9.8 if you want to get technical. It's not 10 miles from 143 to the Med Center. And I mean, I've ran emergency traffic from Johnson Med Center to almost Elk Mill Store.
And
So-
we try to not use wings if we can possibly do it, because the burden it puts on them for their cost. I mean, you're talking $40,000, $50,000 according to where you got one way. And so, I mean, if it's life and death, or if it's, we will call them. I don't put a price on somebody, but it can get where you abuse it, and we stopped it. And my people paramedics can do anything or better than that bird or that ER. They can't do too much more than we can do in the field. We do trachs, everything. And we bring that to the people on site. And it costs us to do that. You don't pay good, you don't get good people, basically. And, you know, when the hospitals started taking away all the older people that had the knowledge to do it, well, they got tired and left. Now you've got young people, they've got the degree. I don't say nothing bad about it, but they don't have the experience what to do. And just like us, if we turn over all the time, it's dangerous to get a new person in there. Used to, they wrote 3 months before they ever got turned loose. We're having to turn people loose in 2 weeks.
After 2 weeks.
Yeah. And that ain't enough time to be with another medic in the back of that truck. If you don't get the resource and money in, you can't do that. So I'm trying to bring you up.
Where are we at right now, or where are you guys at as far as what you're able to pay compared to the rest of the state? And I have a reason for asking that I'll come back to. Your pay scale that you're using right now for your people, how does that rate with the rest of the state in the same field?
It varies so much difference. I mean, you still got rescue squads that does it free, okay? But you've got privates, you've got everything. We're probably, I know Southern County.
It's complicated because they're on a different
They
pay.
are on
They do the
different
24
scales.
hours still, and we don't.
Southern County is on a 24-hour shift. We used to be, now we're on a 12-hour shift.
And our pay rates went
And it's different.
Way up.
It went way
by
up,
hour.
but Saturdays they work. So, I mean, I think I'm low. I don't know how much really low. I haven't really sit down and it's hard to get their prices, if you know what I mean.
I understand. The reason I even bring it up is I know from listening to the budget meeting where it was brought up to go ahead and send it here first.
Yeah.
That's probably where you're going to have opposition. I don't think there's everyone's aware.
It's not,
No, I'm not at all against
I
it.
know it. Listen, I gave them the budget, what it's gonna take me to do in a contract. If they don't do it, then I can't do it. All the stuff I do for the county is gonna be gone. It's gonna be gone. Sheriff's Department, whoever they get to run it, I don't care. Because I can't afford it, can't do it. Either I die fast or I don't die a slow death. And we just talked about this day. I'm not gonna die a slow death. The proud I am to be in that organization for 40 years that I've been there. I'm not going to do it. It's not going to be done on my watch. I'll say, go get your own, whatever you can get. But I'll tell you right now, it's going to cost you a lot of money. I'm from Carter County. Went to school here, did everything she did. It's a part of our living. We've always been part of this county, but we're not government. And I've done what they told me. They sit right up here. Mr. Tom Barrett sit right there and said, you cannot charge nobody from the county. You take it out of the 170 and it's nowhere on record. Nowhere. We did what they said to do. I took it for granted that it was what it was going to be. I could have been charging all this time. So, I mean, you got to pay for it. One way or the other, you got to pay for it. If you don't, then it's on your backs. I ain't being ugly or mean or anything. I want it to work out. But I'll not stand, just like I told the budget committee several years ago, I am not going to stand here and take care of this crap no more. That's it. They publicly done everything. I couldn't even go out to eat with somebody didn't have something to say in my family. I said, no more. I will come after you. Thank God that this has changed, believe me, but I won't take that kind of punishment anymore for what I do for this county. I'm not going to do it.
I don't blame you.
Contract, if they don't like it, so be it. Yeah.
On the convalescents, do you pick people up from nursing homes and take them?
Yeah.
Okay,
I pick them up everywhere.
okay, I didn't know.
And they wait a long time because
Listen, during the pandemic, we spending, what's the average time? Hour, 2 hours
In the ER.
in the waiting room. we're still
I
setting.
think I misread it because it said you take them to nursing homes, but you take them from nursing homes to.
Yeah,
We went in, sir.
Where they
Like if they pull out their feeding tube at a nursing home, then
There's a guy called me
they go take them.
one day, Monday,
The second, yeah.
and said, yeah, we'll take you. Insurance ain't gonna pay it. You can make payments. We're gonna take them out of the state. I
We
don't
were
know.
gonna take him to a hotel near
Yeah.
Duke.
I don't know. Did they go?
They found a different way. They found.
But yeah, we'll take you where we go. Medicare won't pay. I can't unless I've got a lot of money from the county and everything. You know, they pay for that stuff. I've got to charge them. I'm paying somebody time and a half or whatever it may be to transport that patient. They didn't need it, but I understand their circumstances. It'd be awful uncomfortable to ride 3.5 hours in a car that you gotta stretch out. We've had a lot of those cases, and we do whatever it needs, but, and, you know, it's all up in your all's hands, what you all want to do, full commission to.
I just,
Actually, I'm sorry. I was just gonna say, when we were at our, the meetings we were just at last week, there were a lot of services there from other parts, other states in the country. And for those convalescent trips, they would charge people up front, and they carried card readers with them. And if they couldn't pay for their transport to go get an MRI, they specifically said for an MRI, then the people just had to reschedule it because they won't take them if they can't pay
The
at
company,
the time.
The nursing home pay, or is it Medicare or?
some Medicare, Medicaid.
It
private.
depends on if they're in a skilled nursing facility, then the nursing home pays. If they're not, then it's
It's
their
really
insurance.
complicated
or-
how things,
Yeah, it's
if you ain't in the business, it's just mind boggling how.
Do you have enough manpower to do the nursing homes also, or is it just?
Right now, we're doing them all, everything.
Yeah, we have 3 trucks on just to do those convalescent calls.
What if it's a resident of Carter County, but they're in a nursing home in Washington County?
Well, I can't run point to point, nor can they come over here and run point to point. If they're over there, then it's Washington County has to transport.
Unless they're coming here, we can go get them to bring them here.
Now,
We
just
can't
like the
take 'em.
VA, they've got the contract for the VA. We lost a lot of VA calls because they was the contractor and they subcontracted down to us, but you know, we don't get them. They make them themselves. But, you know, the VA just hit, what is it, was it 20% reduction in revenue?
Well, they changed it to the Medicare allowed
Not
amount,
allowed.
instead of
Yeah.
the whole
Lost
charges.
A lot of money.
and that's significant.
So you gotta be in it and to understand it back and forth, how it all works and does. Thank goodness I got Nancy to do some of that
What if
stuff.
it got to the point where you didn't have the manpower for the nursing homes? Could, say, one of them contact a private or?
Franchise won't allow that. The franchise I have with the county and city. But let me tell you, I don't know of any, now they might get mad and say, you know, we'll just reschedule it, but we've always got there. We always come. And, you know, I'm not gonna take a transport to the hospital for a UTI when I've got a cardiac arrest over here, you know? We'll make that call, as an example, then we'll get that person, take them in, you know? But it's just like the pandemic, we were stuck in hospitals for hours. It's still going on, not as bad. We came up with our rules, we sent it to Ballot Health. Hey, over, what was it, last 40 minutes, 45? We left. You know, we had to, because they was using ambulances for hostage, what they was doing. They was freeing up their nurses, making us sit all in the ER waiting in line. And they got by with it, you know. But guys, it's, I can sit here and talk, but at the end of the day, it's a contract. If they don't go for it, you know, I'm sad for them, but
I just want to say, all of us have family and kids, and
and
the first thing, if you're in a wreck, what do you think? Call for help. So I just pray that budget and everybody through this remembers how important for everybody, whether you're home or.
if a real company was to come in here and do all what we do, I don't even know if 5 million would even catch it. I think it'd be a lot more.
That was just rescue side.
Yeah, just the rescue side, yeah. So I hope the best. And, I hope so. I think it's It just got down to the point, you either do it or you don't. You go home, plain and simple. But you don't, look, this is me saying it, but you don't go all these years and never raise taxes. You'll get so far behind the need, you gotta have a great big tax. And it's not this, it's the past. And I've talked to commissioners, said, they didn't want to do it because they own so much land. Get out of the commission, you don't need to be in there if you're doing that. You're doing it for yourself. But I'm for the people and I always will be for the people. There we go, that's about all I can say.
Thank you for what you do.
Got a motion.
Jerry made a motion.
No, ma'am, I retract that statement. I was just talking to my buddy right there.
No, you made a motion to accept it earlier.
You had a motion on the floor.
Yeah, I'll make a motion to accept their contract. I was talking to my friend over there. Thank you very much. We were.
I ain't got no friends in here, Jerry.
It's already been passed.
Jerry made the motion. Who seconded it?
Mr. Chair,
Yes, sir.
may I ask we do this with a voice vote?
I was going to. Thank you, though. Yes.
Nick Holder,
Yes.
Avery Wynn,
Yes.
Angie Odom,
Yes.
Jerry Prophet,
Yes.
Lisa Childress,
Yes.
Todd Smith,
Yes.
Daniel McIntyre,
Yes.
Thomas Prophet.
Yes. Thank you all. Any more commissioner comments? Not you, Jerry. Motion to adjourn?
Motion to adjourn.
All right, I'll call moving grounds to order. Put the roll call stand from the previous meeting. Can I have an approval of the agenda, please?
I make a motion to approve it.
Motion, second. All in favor, say aye. Can I have an approval of the April meeting minutes, please?
Motion.
Can I have a second?
I'll second.
Made a motion.
All in favor, say aye. Any public comments? None. We have no new business. Some old business. County Archives, there's obviously no update. However, with the meeting,
Okay.
so there will be a meeting for Archives on the 16th. Again, if anybody hears of property or knows of buildings, jot it down, keep it in mind, let's discuss it because that's one of my goals is to get this taken care of. Kind of kick this can, so let's try to get that addressed. I know everybody's been focused on budget. Let's really focus on trying to get that somehow. Any questions, concerns, comments? All right. So the Sluter property, I think we've discussed that, discussed maybe 2 months ago, we would take to lease that property over, be used for broadband situation. I sent the lease out. Tony Hardman. Did everybody have a chance to look at that, look over that? I think it's pretty cut and dry. Is there any questions about it?
I will say the term was not my idea, that they sent an initial draft in 30 years is what they asked for. I mean, I didn't just pull that out of the air. So that's the reason 30 years is in there, but other than that, there's not much else I would question. But that's completely up to you. Obviously, they're going to install some pretty significant equipment and they intend for it to be there for a long, long time. So that's why they're asking.
theory is if they're going to invest here, we should at least act in good faith. I'll need a motion or
I make a
discussion.
motion to accept this.
We'll do a roll call vote for this, please.
Ms. Holder,
Yes.
Avery Wynn,
Yes.
Angie Odom,
Yes.
Gary Crawford. Ms. Childress,
Yes.
Bob Smith,
Yes.
Daniel McIntyre,
Yes.
Thomas Prophet.
Yes.
All right, any commissioner comments? I will say this real quick. Thank you all for being patient with me for the last 2 months. Everybody kind of knows what was. I appreciate you all bearing with me, and then Vice Chair, thank you for stepping in, taking on the, won't seem just this much. But no, I do appreciate it, and I just want y'all to know that. Other than that,
Can I make a
Adjourn.
remark about something before we adjourn? I don't even know if this is the place for it, but it's something that I've been kind of throwing around, and as well as Donnie has been talking about it. And we've had a couple of groups come and offer sites for playgrounds and parks and things like that. And we've had a couple we've had to turn down because of location. There is a perfect location in Hampton, if that were to come up again, or find someone willing to do that. It belongs to the city of Elizabeth, and it's part of the watershed, but it's a perfectly flat field right across the road from Butler Mansion. It's completely flat. It was Clyde Cates's cornfield for probably 50 years up there. But it's as flat as this floor, and if we could come with some sort of agreement with the city of Elizabeth, and if it comes up again, that would be an excellent place for a park.
well, I'll say this real quick. Me and Commissioner Frazier's been in conversation. He's going to be coming, and I think I've told you all this a couple of months in a row. But he's obviously here weekly right now with everything going on. So me and him had a conversation a couple of weeks ago to maybe hold off on getting Park and Rec in here to present to us until after budget's over and some of these meetings slow down. That way he could come in and kind of give us an update. And that would probably be a good time to start that conversation, just to see and introduce, we can have a conversation here in this community. I took playgrounds, accessible playgrounds, and I can't remember what was attached to that, but I took that off of this meeting just because I felt like no updates, there was nothing really needed to be. So I'll go ahead and add that to next month, and maybe next month, Mr. Frazier, he'll have some time, not having to show up at so many meetings he's had to here in the last couple of months, and we'll start addressing that and see what we can maybe get with that. Thank you for doing that. I appreciate that. Anything else?
Motion to adjourn.
Second.
All in favor?
Aye.
I didn't make an agenda or bring this back up because I really didn't think that it was gonna go. After we talked last month, I just didn't want to beat a dead horse. So I don't think it'd be too hard to, do what we need to do, if we have to, especially mid-cycle. So I didn't bring it back up. That's why I didn't. I think I got the information we needed. That's why I didn't. do nothing with it.
I do have a question regarding something possibly in the rules of bylaws that's been brought up in this past couple of weeks. And I'm assuming this is where it would be, and I don't even know, our attorney will have to tell us if we can do it. But last night it happened again, and then the other week, someone made a statement, and I know there's been 2 times now that it's on the news because someone gets interviewed and they throw out a number of a tax increase. And our phones blow up, we get emails. Nothing has even been voted on or fully talked about in a budget meeting. Nothing's been pushed even to the full commission. That 3 different people last night, in because I attended the landfill meeting, and as we were sitting on the back rows, like, isn't there something we could do that just says, you don't project increases and any of that things until it's fully passed and on to the full commission? For we're not out, you could go give your opinion tonight, you could give your opinion tonight, but when we're interviewing on news, that sends a panic through all of the citizens, and then it affects everybody. If we are saying something that's actually not even true at that point, it's projected. I'm just asking, because others have asked that question too. If all we're saying is, when it comes to property taxes or wheel tax, any taxes, that is going to be an increase, that it is not to be spoke about to media. You would have to just be media, period, until it's actually passed. Now, I don't know if that's even possible, Josh. It's not possible. He's saying no. Well, then I just think we all need to make that statement to each other.
If somebody's here in public,
It's there, yeah.
I agree.
Because it's not fair to the citizens hearing this stuff, freaking out. And I'm like, no, this is why they're still in discussion. There's budgets. They're still looking over. Now they're all going back and getting, 4%, maybe more off of each department and looking back things or anything. Attend to all of the budgets if they don't understand. But the ones that are saying it are on budget. And then that's what makes a little bit more, and I know one person was addressed, but last night that person hasn't been
I
addressed
don't
yet.
think you could, in my opinion, I don't think you could tell somebody like you
Yeah.
can't say this.
I know. I was just asking because
I mean,
overall they
I might be
were.
wrong.
No, you're,
Well, maybe we all can just understand the fact
Yeah,
that
I
when
know
we
you're-
say like that, there's consequences to our
There's a lot of
citizens
questions.
again panicking over stuff.
Well, the problem is the second case happened after the first case had
I
been
know.
discussed and addressed, and it happened a second time, just the very next night.
The very next
To
one.
play devil's advocate, I think that the parties involved are trying to be as transparent as possible. And,
But we sat in on those meetings and it wasn't said that way.
well, I'm not taking sides. I
understand.
I really believe that the goal here for this commission, starting out with this news, to be as transparent as possible. And I really believe that's the intentions. Now, sometimes they may fall in a different direction, but I don't think, personally, I'll let you tell anybody what they can or can't say. And I'm 100% against making any rules to tell somebody. I don't think that's obviously legal or constitutional, so,
Well, the way that these people took it from the news, and all, I don't know if y'all, how many in here got at least one phone call or email? Okay. They kind of took it like it was real and it had passed, by the way, also that the news portrayed it as well. So the way that they also, WJHL put it out there.
People want to read the paper. Right now.
Sorry, John. Or let's say, sorry, guys.
oh, yeah.
We're not saying that. Just say, this is what they're projecting. It's not it.
Just gotta end it.
Well,
I've got some golden remarks on my voicemail I'm going to say for historic sakes.
I've got some, so just took it out.
I was talking to one lady who got off the phone, had two.
didn't have this.
While I was on the phone with her, I was like, dear Lord. You hide better than I do.
Everybody's anxious.
I guess I better turn off. We're walking out.
yeah, you
Leave it
better.
on and you're doing
They'll
that
just,
singing.
you're looking at it.
Oh, you do that too.
I'll put it on there. Just, yeah, give me.
Very be good now. When you get the sling off.
Some of that stuff in there.
Well,
Get all the way through May.
What I was interested in is